Hello, everyone. This is your host, Brittany, and thank you for joining me on this week's episode of PCAT and Pre-Pharmacy Podcast, where we discuss everything pharmacy from the pre-pharmacy journey to life after pharmacy school. This week, I am joined by Dr. Adrienne DeBerry. She is a board-certified pharmacist, entrepreneur, and public speaker. We have such a great conversation on why she started her businesses, her experiences during residency, and also she gives us some tips for public speaking. This episode also includes a visual component in which you can just look up Crack PCAT on YouTube or click the link in the description box. Now let's get started with the show. All right. Thank you, everybody, for joining us on this week's episode. I have a special guest with me this week, and I will allow her to, introduce herself.
Hi, my name is Dr. Adrienne DeBerry. I am a clinical pharmacist that specializes in ambulatory care and specialty pharmacy. I completed 2 residencies, my PGY1 in general pharmacy practice and my PGY2 in ambulatory care pharmacy, and I'm just really excited to talk to you guys today.
Thank you. Thank you. And so what made you interested in pharmacy?
I have always been interested in pharmacy from a young age. I was sick a lot growing up. I had pretty severe asthma. So as I was treated for that asthma, I probably was in the hospital at least once a year, every year, usually around October. And I was curious as to how in the world these medications were actually helping me to get better.
Okay.
So that's kind of where my interest in pharmacy started. And I was pretty fond of chemistry in middle school as well. So it just kind of blossomed into a pharmacy career. And I really like helping the patients and kind of seeing their improvement over time with some of their conditions. So it just seemed like a natural fit.
Oh, great. So can you give us like a rundown of your pharmacy school journey? Did you take a gap year or anything? Did you intern while you was in school? I like to kind of share people's journeys in pharmacy school and to pharmacy school because everybody gets there in a different way and it's always very unique to them, and to allow people to know that there's not no one cookie cutter way on getting into pharmacy school. So can you please share your experience with us?
Sure. I know when I was applying and looking for different colleges of pharmacy, one of the things that stuck out in my mind was where did I want to end up?
Mm-hmm.
So originally, my plan in pharmacy school was I was going to go work retail and I was going to be able to talk to patients, counsel them, be able to educate them a lot on their medication. So during pharmacy school, I actually worked retail for 3 years.
Mm-hmm.
When I got to my last year of pharmacy school and I was on my 4th year rotations, I had an incident where I actually got robbed at the retail pharmacy where I was working at, and that kind of changed my life a lot.
I'm sure.
Yeah, that's not really something that you think about or expect when you're in pharmacy school, and it really put in perspective, my exposure to retail. I felt like I wasn't able to really intensely talk about medications and medication safety with patients just because you just don't have the time to.
Mm-hmm.
So it piqued my interest into looking into residencies, and in particular, ambulatory care rotations. I love talking to the patients in the coag clinic, the diabetes services, and really spending that one-on-one time with helping to educate the patients. So one of the things that led me to ambulatory care was that experience in retail and really seeking more of an opportunity to help patients in a one-on-one long-term basis. But pharmacy school was an interesting journey because it definitely tries you.
Definitely.
Yeah, over those 4 years, you definitely find out, how tough you can be and how resilient you can be, which was a good thing too to kind of bring out of you during that course of schooling. But it was It was a good experience overall, and I'm very thankful that I did have the opportunity to pursue a residency because I know not, everyone is fortunate to have that opportunity.
Mhm. Yes. So before you got to residency, I'm sorry, before you got to pharmacy school, did you complete a 4-year degree or did you only do the prerequisites? How did that work?
So I actually did undergrad, and I did my 2-year prerequisites. I did undergrad at University of Florida in Gainesville, and I did 2 years of the prerequisites. And my mindset was, okay, I'll do these 2 years. If I get all my prerequisites done and I apply to pharmacy school and I get in, cool, that'll be plan A. And then of course I'm a planner, so I'm like, all right, plan B. If I don't get in, what's plan B? So it thankfully worked out, and I know from a scholarship standpoint that saved me tremendously. So I try to
Yes.
tell pharmacy students, like, if you're thinking about it, do those prerequisites and apply, because if you get in, it really does help with rolling over some of those scholarships when you do graduate.
Okay, great. Thank you. Now, can we get into, you spoke a little bit about your ambulatory care residency and your experience. Can you expound a little bit more? Just so our audience is basically, they're mostly pharmacy students. However, we do have some pre-pharmacy students. And I just want them to know sometimes you think of pharmacy isn't as broad as it is, and they don't understand, the little specialties and pockets that pharmacists can have a place in. So can you please just give us some background on your ambulatory care experience?
Yes. So I remember when I interviewed for pharmacy school, and that was the first time I had ever been exposed to the term ambulatory care pharmacy. Because at the time, there was a drug company that used to publish a pretty thick book about all the careers you can do in pharmacy. So of course, I'm flipping through it and reading it and trying to figure out, like, is this for sure a good fit? So for ambulatory care, for me, when I first heard the term, I wasn't completely clear on what it was.
Mhm.
I knew it involved patients that were on the outpatient side because they were ambulating.
Mhm.
They were walking in on the outpatient side. But it's just so broad. I
Mhm.
mean, you can practice in the primary care setting with some of those traditional roles that people hear about, like a coag pharmacist, a
Mhm.
diabetes specialist pharmacist, or diabetes educator, um, asthma pulmonary clinic, where pharmacists come in with helping educate on inhaler techniques and different things that patients can do to control their respiratory conditions. So I was familiar with that as I progressed through my first year of pharmacy school, but the role that I'm in now with specialty pharmacy, there's really, the sky's the limit, because there are so many new drugs
Mhm.
that require intensive monitoring, have very nuanced specifics on how to start them with your insurance companies.
Mhm.
They're complex in their dosing regimens for like conditions like oncology, multiple sclerosis, epilepsy. Like, they're literally, if there's somebody sick, there's probably a pharmacist role that is related to taking care of that on the outpatient side.
Okay. All right. Thank you. I have this goes with the flow a little bit, but I want to know, you have a lot of public speaking experiences, and I just want to know, or you can share with the audience, how did you get the confidence to be able to speak in front clearly and under the audience understand you in front of audiences, and I guess presenting your work and being confident in that. That's definitely something that I'm working on, especially with this platform. And I've also joined, I think it's called Toastmasters and things of that
Hmm.
nature. But I don't know, I still don't feel very confident just yet.
It's okay. But you know what I realized? That it's not about like arriving at a place where you feel 100% confident in your
Mhm.
public speaking, because to this day I hate public speaking. But I still do it because it's really an opportunity to share knowledge that you have and your experiences that you have. And 9 times out of 10, the audience is seeking help in some type of way, whether it be education on the medications or understanding some of the clinical decision making that goes into selecting a particular pharmacotherapy regimen.
Mhm.
And I did Toastmasters too. When I was in pharmacy school, we would have, even in undergrad before then, I took public speaking as a course, and I, to this day, still don't feel 100% confident in public speaking. But my approach is usually, well, I know what I know.
Mhm.
I can tell you what I know. I can tell you what I don't know. And if it helps you and I can break it down in a way that's easy to digest and memorable for the audience, that to me is more important than my fears,
Mhm.
especially having interacted with some patients to where they didn't have the opportunity to really hear someone talk 45 minutes about one drug, or even the clinicians that I work with, they're extremely grateful for when we do a pharmacy review or pharmacy education talk, because they're gaining insights that they don't necessarily have, and get it in more of like a bite-sized crunch, so to speak. So think about it more as bigger than yourself. You're conveying some type of information that's necessary to that audience. So it's probably more important to help that audience out than your fears about how you sound. And then the other thing to keep in mind is, most of the time when you're doing public speaking, you know your topic and you've been prepared. If you have, thoroughly prepared, so you know it better than anybody else in the room.
Yeah.
So if you think about it that way too, and if there's a question or something that you're not sure of, be honest. Just say, I'm not quite sure, or I didn't come across that information, but I'll be happy to follow up with you. I mean, because that's the facts. That's what it is.
Okay, so what did you do? So for those who don't know, Toastmasters is kind of, well, it is like a international club for speaking.
Hmm.
From my understanding so far, I just joined, so I'm not. I haven't really dove into it that much, but yes, you go and they help you with different um ways to present different topics and things of that nature. And also from my experience, when people like interrupt you or ask you questions in the middle of your speech or whatever, they teach you how to maneuver around that and still
Hmm.
like be calm in your presentation. So other than Toastmasters, did you do anything else to help with your skills?
I feel like when I was in pharmacy school, we gave so many presentations. It's
Mhm.
almost like you didn't even have time to be scared because you're like, oh God, I gotta present this case. I'm gonna be standing in front of my peers. I'm going to. Distinctly remember we had a course called verbal defense where we would have to basically stand and deliver
Mhm.
on patient cases, and that it would be in front of preceptors and our entire class. And it's almost like you just didn't have time to be scared.
Okay.
But the one thing I have learned though is public speaking is like a muscle. The more you
Yes.
do it, the better you get at it. You can recognize your own little quirks. I know one of my things was I used to talk with my hands a lot.
Mhm.
So the more you do it, you pick up on, oh, okay, well, going forward, I need to be mindful of XYZ. And you really don't know what to expect if you don't put
Yeah.
yourself out there to try to public speak. So the more you do it, the better you get at it. You get feedback and can, revamp and do better the next time.
Yes. Okay. Thank you so much. Okay. So I want to talk about like the specialty pharmacy side and your platform, Real Talk Health. If you can let the audience know about that.
Yes. So Real Talk Health is basically a health education company that focuses more on education of specialty medications for consumers as well as healthcare professionals. Sometimes pharmacy can seem like a foreign language to other healthcare team members. So it's important to kind of help translate and break down some of those complex topics in one a manner that's easy for them to apply while they're, going about their clinical day, and two, easy to remember.
Mhm.
So Real Talk Health is really focused on just that, really talking about health topics and specialty medications. One of the things that, we have is helping pharmacists understand more about the world of specialty pharmacy. because I get a lot of questions from other pharmacists who may not be in the world especially, but are interested in it. And I remember me as a clinician, I didn't have much exposure to it. When I was at the end of pharmacy school and while we're in pharmacy school. So being able to really dive in and work with in my neurology patients and seeing some of the areas where you can specialize in, it really opened my eyes to a whole new world. And I want to share some of that information that I've learned with other people.
Okay. Thank you. And you had a few things to leave for our audience, did you?
Yeah. So thank you again for inviting me to the
Oh, you're welcome.
podcast. This will be like my second one. So I
Oh,
feel like it's a little muscle that's growing.
yay.
One of the things I wanted to gift your listeners is discounts to education services and some of the things that we offer with Real Talk Health, particularly with specialty pharmacy education sessions. And then for pharmacists who are interested in specialty pharmacy, we also offer specialty pharmacy exam certification prep services, as well as different ebooks on specialty topics.
Oh, great. So I will definitely leave all of that information in the description box. And she also has another little gift for you, but I'm going to let her talk about it before we let all that information loose. Now, can you please give us, the background and everything, the concept and how the conception of this project was? It's the Wake, Pray Pharmacy Slay.
So I have always been a very creative person, just by nature, whether it be painting or crafting. Like that's something that has always kind of been a part of me. So in my crafting journeys and different things, I like to make shirts and different gifts for people. And something that I noticed was the pharmacy themed gifts are really boring.
Yes, they
So
are. They are.
so most shirts and different things say like, I sell drugs, ha ha ha. And you're like, yeah, we get it. So my thought process was, how about we make some cute gifts that people are not afraid or embarrassed to show off and actually look like they belong in the home, or look like you would wear them proudly, out and about, or even while you're at work and have like a cute little lapel pin that is something that you're proud of, that's pharmacy related, but also doesn't look boring and dorky.
Yes.
So that's how Wake, Pray, Farm, Slay was developed. And my goal is to try to evolve it to more different things. From like right now, it has like a lot of apparel and accessories, but to evolve it to where maybe we'll have some cute home accessories with coasters and things like that are
Okay.
pharmacy themed, but also not like dorky looking. But
Yes.
things you'd be like, okay, this is cute. This is Pottery Barn level cute,
Yes.
stuff
Yes.
like that.
Oh, great. And so she has, I'll leave all the links to where you'll be able to access that from her. And I believe that's all the questions that I have for you. And I am so thankful to have you on this episode and the information that you shared. And again, I will leave all the links to everything in the description box, and I will talk to you guys later.